How exciting is it that in healthcare, we have so many things we can create, improve, and technology really has been coming up and evolving and changing at the speed of light. And it seems like everywhere we turn around, something new has been popping up. It's exciting. Yeah. How do we truly find out what we need to improve getting the right developers, right solutions out there? So it's actually now slowing us down from learning curve that have to go into every solution we get to there, but actually be able to adapt, to use, to get to the right access to push everything forward. So today, I'm so excited to have RJ here with us. Before we go further, let's go to our quick intro.
Welcome to Health Tech Growth, the weekly podcast for healthcare founders and innovators, where we explore essential strategies to create successful and sustainable healthcare startups that improve patient outcomes and transform the healthcare industry.
So, Mr. Kedziora is the co-founder of Estenda Solutions, and this is a digital health focused software and data analyze consultancy company, and they've been around since 2020,
2003.
2003.
2003. It's been 20 crazy years. Yes.
Yes, 20 crazy years. And then must be having a lot of fun story to share on your journey. And himself have over 25 years of experience serving as the COO, CTO, driving business developments, and overseeing multiple projects to improve patient outcome. And he holds an MBA as well as a computer science major where he received Excellence in Computer Sciences Award, and is a frequent speaker on conferences, podcasts, events all across the board, and has been really someone who just so fun to talk to, having a good conversation, and also is accomplished distance runner and competitive age group triathlon and adventure race participant. So how often do you actually run and train yourself?
I'm at the gym 5 to 6 days a week. Get up, 4:30, quarter of five, kind of thing to get it in before the day goes. Gives you a real sense of accomplishment. So I sit down at the desk usually at 8 o'clock in the morning, but I already can say I went out and swam, I ran, I biked, I did my strength training. Still going to work on the flexibility. I got to do more of that kind of thing. But yeah, it helps balance, the work life kind of thing. And someone even said instead of work life, it's balance, it's harmony. How do you bring both of those together too? Because as you can imagine, as you're out there and you're training a lot for some of these triathlons in particular, you can get tired in the middle of the day. So how do you harmonize, those two different goals? And I'd like to say I was successful at it, but I continue to work at it every day. So.
Yes, I always believe in the word of harmony instead of balance because there's nothing that we can truly balance, right? Like if we put everything 50-50, or I consider there's a 10 component of life, how do you actually put everything so equally out? It's just not feasible for any human being. And just simply finding out the way that we feel good, it still keep us motivated, and despite sometimes it feels like we're pushing against the wall, right? And then we still have that drive to go forward. And definitely plenty of people like you is like that early bird people. It's like get up 5 o'clock club people, right? And then for me, it's like, yeah, that's just not gonna happen, right? Like I still gonna have my morning time to myself, but my day doesn't really start until 10 o'clock. And then
Yeah.
but I go on later on the night.
Well, yeah, that's a flip side. I am usually in bed and asleep by 10 o'clock at the latest kind of thing. So that's where that harmony, that balance comes in, to be able to get up and do the things I do. Sleep is hugely important, as we've been finding out in the healthcare industry. So.
Exactly. And then it's also like, how do we truly figure out what that is needed, right? Like we have all these pinpoints of the physical elements, the emotional element that we start talking even more, right? believe many people in healthcare see healthcare as like, oh, physical illness, right? We're not in healthcare. And I'm like, you're talking about mental health. You're talking about how you, as a patient going through this is all healthcare, wellness in general. We cannot separate the whole body and the whole person from all these different elements to just, oh, healthcare, you guys are just trying to do surgery on me or giving me medications, right? Or you only see me when I'm feeling bad. No, we really need to shift the dynamic of what healthcare means, and also leveraging technology and tools and innovation to do that for us. So we don't have to feel like, well, there are going to be human error. So how can we use tech to help us to reduce that and increase the satisfaction, getting things faster, right? And then, so for you guys, is that where you guys started in the way of the concentrating in those particular domain of healthcare?
Yeah, we got our start with, interestingly, a congressional grant for development of a diabetes disease management solution for military healthcare. So we worked with Walter Reed Army Medical Center, Boston VA, the Indian Health Services here. And that really launched us, through the first 10 years of our existence. And then now more recently, it's a blend between commercial work with large companies, some smaller startups, but still very much that research-centric focus, understanding the patient experience. And if there's one sort of key element to everything that we've been doing along the way, it's really about data. Understanding that data, understanding the patient experience. And where in 2003, where EMRs were not widely used and smartphones weren't even invented back then. The iPhone didn't exist when we got started. I thought that the other day, and I was just like, wow, that's an experience. And back then it was about, okay, this limited data. How do we get to the information? And how do we make decisions based on that? How do we share it with the healthcare practitioners? And then fast forward today, 20 plus years later, there's so much data, it's overwhelming, and more technologies are coming out to uncover and better understand that patient lived experience. So very often when we partner and help other companies develop solutions they're taking to market, or understanding how their device is used in the real world, we've got some real world evidence projects, so not just in a clinical trial, really understanding how it's used in the real world and connecting that information with the providers. It's not only finding patterns now, but it's like, what do you do with that data? And so constantly we're asking, what's next? As we do get into these solution development engagements with companies, it's usually very early stages. Someone will have an idea or someone has data. It's like, okay, what do I do with this? How do I make sense of this information? And that's where we really bring our strengths to the table of helping to do that. And one of those things very frequently you hear, 5 whys. Ask 5 whys. So I didn't get to work on time today. Well, why? Well, my alarm didn't go off. Well, why? Well, I didn't set it. Well, why didn't you set it? You sort of keep asking those questions to really get to the core of the problem. But I like to think of it like, what next? Okay, so now I have this information about your blood glucose, about your sleep patterns, your heart rate throughout the day, your heart rate variability throughout the day. But what next? That's like, okay, what are the patterns and trends there? Okay, good information. But if you go to your provider, or any of the listeners today, the viewers, go to your provider with your Apple Watch and 3 months of worth of health data and go, what do I do? They only have 10 minutes. They're going to be overwhelmed. So we help these companies develop the solutions, the healthcare systems develop the solutions to, one, find those patterns and trends, but then answer the question of what next. And that's where I transition that 5 whys into what next. Okay, what next? What next? Okay, here's the patterns and trends. Well, what next? How do we make clinically valid, relevant to the patient experience recommendations that's going to make a difference in their lives? And sometimes that's to the provider, and sometimes that's to the actual patient, where you might generate a digital therapeutic application that the patient is using. And everybody has their smartphones nowadays. So let's get to them, where they are. You can really engage with the patient from that perspective.
Exactly. It's always about meeting people at where they are and finding out potential solutions that perhaps they even haven't thought of, and to looking into the potential of everything that has been generated. So the question of the why, especially as you mentioned, sometimes I even go deeper, the 7 layers of your reasoning, right? Because once we got down the so core, despite the difficulty, you still have that core to go back to say, okay, this is my motivation, right? We have to really get going. Now, flipped on the other side of your saying, what's next is that, okay, despite all this motivation you're getting there, what are you creating? What is the true vision, the goals, the final drive? What's that final result? And sometimes I feel like people have this big audacious goal, right, from organizations. Oh, we just want to integrate everything. And it seems like people are trying to chew off an elephant like in one day, right? And then there are people who has no idea. And I recently interviewed someone who they are actually leveraging big data for both the patients and organization to mine them, to say, if you, I own my data, right? That, which is a huge debate nowadays. It's like, who owns the data? How do you use it? What to do with it? And then so that solution is on how you can say, there's my medical record, I have this rare disease, I'm rather to be able to participate in clinical trials XYZ because my condition and my data, so I'm serving the society and also benefit myself, and in the meantime commoditize them, right?
Yes.
And then the organizations will want those data, because how else would they find some of those disease manifestation? Plus, we always know in clinical trial you also have to have a control group, right? So what are these people coming from if you can't really find the participants? So even the healthier, quote unquote, people can participate as the controls. So it's really helping people, as you're saying, what's next? How can you, from the example you gave, that trend, right, in even glucose monitoring system, now there are many different glucose monitoring system out there. A client of mine, they're doing especially type 1 diabetes, right? It's like a fun, really significant work. But then what, right? Like, as healthcare providers, I'm not going to look at every single data point. I needed something to analyze it really quickly, help me to make those medical decisions, and give me that report that I can make that higher level of decision,
Mhm.
right? And
Yep.
without going through all the data point. So it's like a puzzle piece that you're helping people to come together. So what would say you guys being around for 20 years, very exciting, and then have spoke to you many times before, have very different type of company solution that you have brought from. And what was you believe is one of your biggest win?
One of our biggest wins, probably one of the projects, and we've been doing this for 20 years. It's a partnership with the Joslin Diabetes Center at Boston, one of the premier diabetes specific research care institutions. And this ties back to that congressional grant that we had. We developed with them a diabetic retinopathy surveillance program called the Joslin Vision Network, and it's deployed currently uh, within the Indian Health Services here in the United States at about 100 sites across the country. But diabetes impacts is diabetes retinopathy is the leading cause of preventable blindness. So if we can find it, then we can help you as an individual in that journey. And we're responsible for that program now, very much in partnership with the IHS, with Joslin Diabetes Centers, with other experts, PhDs that we work. We just had an article published in JAMA Ophthalmology about some of the AI related work that we're doing. But having run that program now for over 20 years, we're at the millions of images, and significant number of people that we've been able to help over the years. So very, very proud of that program. Lots of small wins over the years. In diabetes, run some R01 studies that have demonstrated software we've created. If you're familiar with the HIMSS organization, Health IT organization, they have what's called Davies Awards. We won one of those back in 2017 based on work with the community health center. So lots of individual victories there. But at the end of the day, it's really about, for us and the people that work for us, about helping the individuals, hearing those anecdotal stories over the years of, hey, RJ or whoever they're working with at Estenda, I made a difference in a patient's life. We found this, which made a difference. And then, different solutions that look at the population health level. It's like, okay, how can we make an impact? And those are really what helps us all sleep a little better at night. I have worked on, the accounting systems and railroad car scheduling systems over the years, and they're all well and good, necessary. It's important. But healthcare has that sense of giving back. So every day there's little wins, and across the years there's many things that we're very proud of. So.
It's fun to be in a place where you're constantly giving, and then seeing the fruition of that, what that impact looks like, and then coming above the ground to say, oh, right, like we developed this program, we start getting funding, grants or awards, people really recognize us, and I think that's what truly drive everything forward. And then, okay, so this is a great project, what's next? Right, like what's could be with that same organization, could be with other organization, really is developing something that can get to the result. And then also at the same time, like we talk about it in the beginning of the show, give us the patience and grace to also reset, relax, and then be able to not beating ourselves on the head, be like, why is it not working? Right. Like, I agree all this. I thought it would have worked by now. Right. And then just keep going forward, because there's ups and downs in any entrepreneurial journey or any creative journey for that matter. And so for
Yeah.
you guys, let's say we give you a magic wand, and then magic wand is your little genie that give you 3 wishes. What would you use the 3 wishes for?
Oh wow, 3 wishes. That would be fast enough to win an Ironman triathlon. Let's see, that my children, wife, and continue to succeed in life. They both graduated college. They're gainfully employed, so that's awesome. They're doing really well. That they continue that. Third wish, that just Estenda and everything that we do continues to make an impact through the years. There's 3 quick wishes for you.
Yeah, that's
Mm.
fun, right? Like, I think everyone, when I ask this question, it's all over the board, right? Some people use all their wishes on their business. Some people's like, yeah, there's part of me that I wanted to use it for, right?
Yeah.
So it's all to your own. Now, here it's really Post Point and the health tech growth. We're all about collaborative growth, because no matter what, we are an expert, we are a thought leader in our domain, but we're never going to be able to know every little thing about everything. And it's also not feasible, and from a leadership growth perspective, to know everything and thinking we can handle everything. And that's why, just like Henry Ford, when he builds cars, right? When people ask, oh, can you do this calculation on ABC? And he's like, why would I want to do that? I can just call one of my engineers to do that, right? So that's the environment we like to create. So if we give you a fully integrated board of advisors of all experts across all 12 domain of business, from your internal integration, legal, ops, financial optimization, to your core nitty-gritty of the business, the marketing, the branding, the visibility, the sales conversion, the strategic partnership, the B2B relationship, and to what makes us special, right? Which is your human capital, your culture, your networks, how you grow your talent from within, how people really align with your mission and not get distracted by their own personal issues sometimes that prevent them from keep going. So when you have this whole on board, and what would be the one question you want them to solve for you?
My current biggest challenge is how to find that customer at the right point in time. We talk about BANT, budget, authority, need, and timing. So we talk to a ton of people, and very often we'll have this conversation about, oh, if I only found you 3 months ago, I only found you 6 months ago, kind of thing. So that would make my life significantly easier if we could really solve that, find the silver bullet out there. I know there are no silver bullets, there are no magic wands, unfortunately, no genies with 3 wishes. But yeah, how do I go out there and find that next customer? Because ultimately, for us, it is about helping the next person finding that next challenge. Like we thrive on those challenges. That's why I got into software development many years ago, and then really found the niche in healthcare software, digital health that we enjoy so much. So yeah, our biggest challenge is really like, how do we find that next customer, that next opportunity?
Yeah, perfect. Yeah, I think sometimes it's that we understand somewhat of what our ideal buyer persona looks like, right? And then it's like, did we know really well enough for us to capture them right at the moment that they actually can self-identify that, or can we capture them way early and then it become a nurturing relationship and then help them to identify when they need us, right? So for you, it seems like to be able to narrow down that and then creating some kind of system. And even for people who say, oh, wish you to know you 6 or 3 months ago, but even though they quote unquote solved it, how did they solve it? Was that the most optimized thing? So they might still need you down the road. So still continue that relationship and getting that ecosystem together, if I'm hearing you right.
Yeah, that's absolutely it. As we do engage with people at the various conferences through, webinars. We have one coming up June 14th about using Gen AI in software testing. It's all about efficiency. How can you be more efficient? So we do those webinars. I just did one on AI and product development. It's out there on our YouTube page, free for everybody to view. But yeah, then we foster those relationships, nurture them over time. Newsletters, additional content, white papers that we put out there. It's nice. I have a couple PhDs on staff, and as we write various articles in peer-reviewed journals, I mentioned that JAMA ophthalmology article. What's interesting, as we've worked with our customers over the years and stuff like that, and very often they're putting our names on patents on these papers that are going out there. And in some cases, they're developers with only a couple years of experience having their names on these peer-reviewed journals. And they're not in an academic environment, so I don't think they quite realize, how significant it is to have your name on some of these journals. But it's testament to our customers recognizing, how much part of the journey we are.
Yeah, it's definitely is, because when we think about publishing, and publishing can be any various form, and you have the traditional healthcare thinking about, yeah, peer-reviewed journals, right? Like a search clinical trial or even case studies. And then you have been also publishing different ways of speaking at conferences, running your own webinar, and doing podcasting like this one right now. It's all different ways to give people the resources they really need, and just depend on how they like to learn, watch, listen, right? Demonstration, and then read. So we can able to capture them at multiple places, what we call the omnipresent, and also be able to say, now you've been doing so many great things, let's bring them back to your community, continue to have that and not have to be out there constantly be searched. So excited to see where you guys are heading, all the amazing things that you guys already done for the past 20 plus years, and can't wait for your next chapter and figuring out the true type of organization that really need your help. So for anybody out there, please go find RJ. Richard is by your first name and then full name on LinkedIn, and his company as well, just to explore. And because at the end of the day, there might seems like other developing company out there, but everyone does have their own niche and specialty. So be open, be curious, be tenacious to really explore what's possible into the future to find your next chapter. All right. Thanks everyone for this. All right, RJ, any last words before we wrap up today?
Thanks. This was great. Absolutely. Appreciate it. Check out our website and our LinkedIn page. 2 weeks from now, it's that AI in software testing. I'm looking forward to seeing everybody there.
Wonderful. Until next time. Bye, guys.
Thank you for listening to Health Tech Growth. If you're a healthcare tech innovator or founder interested in being a featured guest on our show, visit healthtechgrowth.io to learn more.